Afternoon. It's Erika Roar with Assisting Hands Richmond. We're here for the Friday finish, and we're going to run through a few of the week's events, and then I'm going to introduce my shout out, who's Mary Catherine Kolbert with Dispatch Health, and then we're going to wrap it up. So hopefully we'll not be on too long. Let me do a few things I gotta get ready. I'm kind of producing my own little show here. So pull that up. Great. So again, I'm Erika Roar. I'm the owner of Assisting Hands Richmond. We are a home care company, and our services help support individuals in their homes, wherever they call home. And that could be a traditional home, it could be an independent living or an assisted living community or skilled nursing facility. So it's wherever they call home. We help with activities of daily living, such as bathing, grooming, toileting, transferring, cooking, and cleaning. And we also specialize in dementia care. We have a certified dementia coach that trains all of our caregivers on specialized dementia training. But really, you know, a lot of people really don't understand what we do. We also are there just to kind of help people stay in their homes or stay happy in their homes. We had a client that needed help with just a couple of the ADLs, but really what we did is we would go keep him company. We drove him to the library. We would drive him to adult learning centers. We'd go help him get his hair cut, and really just kind of helped him remain happy and at home. And that's really what we wanted to help people do, is remain happy and at home. So if you have anybody that is in need of those services, we would love to speak with them and see if we can help them out. So this week, it's been kind of a busy week and month. A lot of different, as everybody knows, it seems like it's the week celebrating something, the day celebrating something, but this whole month is Alzheimer and Brain Awareness Month. And as part of that, tomorrow is a big day. So I don't know how many people know that tomorrow is the summer solstice or the longest day. And Alzheimer's likes to use that as a reminder of having fundraising events and just kind of having the longest day be a day where we're fighting against the darkness of Alzheimer's through fundraising activities. And I'm going to ask Mary Catherine, when we talked to her, she was just part of a really impressive event yesterday that helped raise a lot of money for Alzheimer's in conjunction with the longest day. So we'll talk about that in a little bit. And the other thing that's going on this week is it's the 43rd Annual Nursing Assistance Week. And those are for, you know, CNAs, PCAs, home health aides, that are either in hospitals, in communities or facilities, or like the caregivers that we have working for us. And so this is just a great time for us to thank them for the jobs they do. And I think especially now, and I'm not happy that COVID-19 happened, but I think it's helped raise the profile of all these frontline workers that are going in and helping people out with taking care of them. And certainly all these nursing assistants are part of that. So we're really thankful for them and all that they do. So we're actually going to be dropping off treats and recognizing people all week. So now I'm going to bring in our shout out for this week. It's Mary Catherine Kolbert with Dispatch Health, and she's the community engagement manager for them. And Mary Catherine has been really helpful for me. I was new to the industry. We actually have some very loose non-work ties that we knew each other. She knew my wife. And so she was helpful in kind of giving me some advice very early on things I should and should not do. And she's always been very helpful for that. So Mary Catherine, thank you for joining us. And, you know, let's talk a little bit about Dispatch Health and what you all are doing.
Well, thank you for having me, Eric. I appreciate it very much. Yes, we do have some loose ties, kids at the same school. It's all, you know, the Richmond community for sure. So as Eric said, I am Mary Catherine, and I am the Community Engagement Manager for Dispatch Health. And Dispatch Health is medical care delivered to you, just like the slide says. So we do treat urgent matters. So anything that you would go to a patient first or a better med, those type of places, you can call dispatch and we bring our either nurse practitioner or physician's assistant to your home along with a med tech to take care of anything that you would need, as I said, that you would go to an urgent care for.
Great. And so, where do you see the people and kind of what parts of town do you cover?
Sure. So we serve all of Greater Richmond, so 30 miles from city center. So that goes as far north as Ashland, as far south as Chester, and we go as far east as parts of New Kent, and I'm also blanking near the airport out that way. And then we also then cover back over to Powhatan and Goochland. So the best thing to do, you can go on our website, dispatchhealth.com, and put in your zip code, and we'll tell you if we cover that area, because we take on the entire zip code when we cover. And we have limited it to the 30 miles from city center to delay or make the drive time in between our patients shorter, because we don't want someone waiting an extended period for care. Currently, we have 6 teams in the community, that nurse practitioner or physician's assistant plus the med tech, that's a team, being able to see patients, and they can see between 5 and 7 patients a day. So right now we can run about 40 patients seen in a day. And we come to your house. And just like Eric was saying, wherever home is, whether that's an assisted living, memory care, independent living, freestanding house, apartment, we'll even come to your office or school. We just need a room that we can close the door for privacy to assess your needs and take care of you.
Great, great. And are there any restrictions of who you will or will not see?
So we really treat anybody 3 months and older. So really anybody can be seen by us. We, when you call us, we have a risk stratification tool that's very fancy for us. We're going to ask you what's going on with you and make sure that we have the equipment and the knowledge in our teams to take care of you. Or we want to make sure we can get there fast enough to take care of you as well. So if you having a heart attack, stroke, uncontrolled bleeding, fall and hit the head, and you call us, we're going to tell you to go ahead and go to an emergency room, because we don't have a CAT scan. We can't get to you fast enough if you're having stroke-like symptoms or a heart attack. So we want to make sure that you get to the best place of care in the most timely manner. And that could be us, but sometimes it might not be us. And there's never a charge to call us and talk to us and find out if we can come and help you or not.
Do you have any restrictions about COVID-19?
We can see patients that have COVID-19 that are positive. We can test for COVID in the home as well if you have symptoms that are in that realm after we assess you and we feel you need a COVID test. We are fully decked out in that personal protective equipment, that PPE there we talks about, and we have very strict protocols about cleaning our equipment, cleaning our cars that we come to you in, and making sure our providers are protected so we aren't contracting COVID nor spreading it. So you can feel safe if you call us to come to your home, that we're not bringing COVID with us, and we can treat you if you are positive or need the test.
Gotcha. And how much does all this cost?
Great question. So it's the same price on your insurance as if you went to an urgent care, exact same copay as we bill as an urgent care. So we take all commercial insurance payers. We also take Medicare, we take Medicaid. And if you have Medicare and a supplement, you probably won't even see a bill, but it's the exact same copay as if you walked, or actually got in your car, drove, waited at a patient first, same price, but you can just stay at your home in your pajamas if you'd like, and we'll come and see you there, but same price.
Yeah, I think it's a great service. And one of the things I really like about it, I view it as a complimentary service to what we do, because
Absolutely.
again, it keeps people at home. It keeps ERs and hospitals from being overwhelmed. And, we actually train all of our caregivers on Dispatch Health. We provide them all the materials in terms of calling, because, we don't want people to have to go to the ER, and especially now with COVID-19, where it's not necessary. So that's great.
That's right. And
So
that's what we like to say, Eric, about working with folks like you. We're all on team, don't go to the hospital. That's what we are together to do, is make sure people don't go out when they don't have to. Absolutely.
Yeah. All right. Here's your final question. I'm going to let you go. if there's a college football season this year, who's going to win the national championship?
Well, Eric, of course, I have to say, University of Georgia.
Oh my goodness.
Absolutely.
That was totally, she did not even know I was going to ask her that. And she had her Georgia swag.
Of course. Oh, look, and my purse as well. Hello. Yep. I'm all Georgia all the time. That's right. That's right.
I'll root for Georgia as long as they're not playing Ohio State. So anyway,
well, that would be an amazing matchup regardless, for sure. So, well, thank you for having me. And
thank you.
I hope everybody has a great weekend. Happy Father's Day to everybody.
Great. Well, thank you very much, Mary Catherine. Have a great weekend.
Thank you. You too.
All right. So the next shout out I want to give is a great segue that Mary Catherine gave us. The next shout out is for my dad. Happy Father's Day, Dad. I got a picture of him up on the screen. That's my dad and my mom out at the Outer Banks from last summer. Both amazing people. My dad, I will brag on him a little bit. He is still playing golf as often as he can. Many times he'll walk, and he is consistently able to shoot his age. And he's 82 now, which I think is great. He actually will shoot under his age sometimes. As I've said to him many times is, I will need to live till I'm 150 and not have my golf game get any worse for me ever to accomplish that fact. But I love my father very much. You know, a lot of my value system has come from both my parents. My dad is a retired Presbyterian minister, but also an ethics and philosophy professor. And I put up a quote on the screen that is one that he has at the end of all of his emails. And I think it's just a very appropriate phrase at any time, but right now, and I feel like if we all lived by this, that we would be in a much better place. And that's do all the good you can, by all the means you can, in all the ways you can, in all the places you can, at all the times you can, to all the people you can, and as long as you ever can. And I think that's just, I think the way he lives his life, I think if we all lived our life in that way, we could get out of some of this divisiveness and rhetoric that is dividing us and can bring us together. And I think that's what we just need to focus on. So happy Father's Day to my dad. He'll be coming over. Him and my mom will come over for dinner on Father's Day on Sunday. So anyway, great for him. And I love you very much, Dad, and I can't wait to see you. So that's pretty much what we have for this week in our shout outs. And we're looking forward to seeing everybody next week on our Friday Finish. And, you know, I'd love for anybody to give me suggestions on anything they'd like me to talk about. And let me pull up my final slide here and just remind you that, you know, we're here. Our goal is to keep everybody, helping them remain happy and at home. And I hope everybody has a great week, and happy Father's Day to all the fathers out there. Thank you, and have a great weekend.